And now recognize Mr. Archer for his 5 minutes opening statement.
Thank you, Madam Chair, and thank you to the Health Subcommittee and Oversight and Investigation Subcommittee for holding this hearing today. My name is Stuart Archer. I'm the President and CEO of Oceans Healthcare, a system of behavioral health facilities located throughout Texas, Louisiana, Mississippi, and Oklahoma. Oceans Healthcare prides itself on 6 core convictions: dignity, comprehensive care, quality, integrity, advocacy, and teamwork. These values are the foundation of our company and what drives our employees to provide the highest quality of care. Oceans Healthcare was founded in 2004 specifically to meet the behavioral health needs of the underserved, including our specialized programs for our nation's military and first responders. Headquartered in Plano, Texas, Oceans Healthcare has 33 locations, 23 hospitals, employs over 2,000 caregivers, and serves over 24,000 patients a year. Our centralized support model provides Oceans hospitals and care teams with the operational resources and expertise they need so they can focus on what they do best, providing high-quality, compassionate behavioral health to patients and families. Furthermore, this model has given us the ability to further expand into rural and underserved areas. In fact, Oceans often stands as the only behavioral health provider in the communities we serve, providing access to quality behavioral health to those who might not have it otherwise. At today's hearing, I look forward to discussing access to behavioral health resources in our nation's border states. Oceans Healthcare has 18 facilities throughout the state of Texas and is certainly no stranger to the struggles that care providers within Texas have been facing. Safety and compassion, we believe, are not mutually exclusive. Our hospitals have a duty to provide quality behavioral health care to our communities, but this has been challenging because the resources are so limited. Healthcare providers have a moral obligation to care for those in need, including those coming across our border, but this presents a challenge when we don't have sufficient staff, resources, or are treated in the way that behavioral health providers are treated many times. Oceans is experiencing the same challenges as other hospitals across the state of Texas. In particular, finding clinicians has been extremely challenging for some time, and this challenge has only been exacerbated by the COVID-19 pandemic and further escalated by the border crisis. To say it's challenging to incentivize behavioral health professionals to work in rural and underserved areas is an understatement. These behavioral health professionals know that when they choose a role in behavioral health, they often find that their pay is far greater in urban areas, and many times, instead of selecting the specialty of behavioral health altogether, these healthcare professionals can make significantly more by simply choosing a different healthcare specialty. Oceans Healthcare is working hard to provide care in areas that might not otherwise have access, yet we are facing challenges due to a lack of parity within reimbursement. Not only is there competition between various hospitals and specialty, but there's also competition within our border states, as hospitals must also compete with the federal government to staff border facilities. Furthermore, it's been my experience that our law enforcement and first responders have been particularly impacted by the mental health and substance abuse issues they're confronted with daily in their jobs. Instead of allowing our law enforcement to do what they do best, we have instead depended on them to also serve as healthcare providers and mental health specialists. We have to work on increasing partnerships with local law enforcement, and I'm proud to say that all of our hospitals partner with local law enforcement to work with their mental health deputies. Finally, taking a broader approach to understanding why our behavioral health resources are so scarce and finding ways in which to improve access, we must understand that many of our federal laws and policies surrounding behavioral health are antiquated, and while parity is a laudable goal, this crisis has made the inequities in behavioral health all more evident. For example, we must follow the precedent many states are setting by implementing innovation waivers and phasing out the Institutes for Mental Health Disease Exclusion to provide greater access to the populations needing inpatient behavioral health care. I'm honored to have this opportunity to testify in front of this committee and hope to offer an important voice, specifically those working to improve our nation's mental health. I'd also like to thank this committee for its work in passing the Restoring Hope for Mental Health and Wellbeing Act last Congress. Between the COVID-19 pandemic, our border crisis, and a mental health care crisis, strain on our nation's public health resources has been building. It is a duty to assess the effectiveness of our current policies and work together to find ways to make improvements that will expand access and to ensure those who need care can receive it. Thank you for this opportunity.